Thank you for joining us here tonight. I'm Eowyn. I'm the chair of Whatcom Democrats. I want to thank Gwen Roden and Jessica Rienstra, Kelly Krieger, Brandon Roundtree, so many volunteers who made this possible tonight. It took a bit of doing. This is really the conversation that I've been wanting to have since the inauguration. This really came about from my own kind of cognitive whiplash, trying to understand how I should be processing and reacting to the first few weeks of the second Trump administration. We were told by the president himself and our former president and every talking head in the country what to expect from a second Trump administration. We knew that he tried to stay in power after losing the 2020 election. We knew about his fondness for autocrats. We knew about the radical constitutional interpretations favored by some of his closest advisors, and the wrecking ball that he said he would take to our democratic institutions and the post-World War II global order. And then he won the election. Joe and Jill Biden had Donald and Melania Trump over to the White House, and they had tea, and they posed for pictures and smiled in the Oval Office, and there was this very normal handoff that felt confusing, given that our leaders had been telling us that this would be the end of democracy. I've felt disoriented ever since then. And I think most of us have struggled to process the torrent of news over the last couple of months. A pace and a scale of executive orders and funding cuts and personnel changes that is designed to be overwhelming. So that's, I said this to a friend of mine who said, yeah, I want to know, like, it seems like the house is on fire. I want to know which rooms exactly are burning, where we think the fire might be spreading next, and is there something we should be doing to try to put it out? So that's basically the goal here tonight. We could easily dedicate an entire evening to any one of the sectors represented on this panel. I admit feeling guilty or a little greedy about packing all of these distinguished panelists just on one panel. But the goal is a kind of top-line check-in to start the conversation, I hope. I hope we can all leave here tonight with a clearer understanding of what's actually happening in DC, what folks who work in these sectors, what they're paying attention to, what they think is the most consequential. Some predictions about what might be coming and how those could impact us locally. And then ideally maybe a couple of action steps, things that we could be doing at the city or county or state level to fill gaps that are starting to appear in federal services, or maybe places where we need additional legal protections at the state level where we used to have them at the federal level. Because with a chaotic administration and a dismembered civil service at the federal level, I think it matters more than ever what we can actually accomplish locally in our own community. So I want to introduce our distinguished panelists this evening. Jeremy Harrison Smith has served as the Northwest Washington representative for the governor's office since April of 2023. First for Governor Jay Inslee and now for Bob Ferguson. Prior to joining the governor's office, Jeremy was campaign manager for the 2022 re-election of Representative Alex Rammel. He was previously executive director of the Scleroderma Foundation Northwest chapter, and he taught preschool at Burlington Middle School. Dr. Greg Baker has served as superintendent of Bellingham Public Schools since 2010 and was previously deputy superintendent for Portland Public Schools, special assistant to the superintendent of Boston Public Schools, and administrator for Spokane Public Schools. He began his career in Alaska as a teacher and assistant coach. Silky Shah is the Executive Director of Detention Watch Network, a national coalition building power to abolish immigrant detention in the United States. And she is the author of Unbuild Walls, Why Immigrant Justice Needs Abolition. She has been working as an organizer on issues related to racial and migrant justice for over 2 decades, and is regularly interviewed by national media outlets, including the Washington Post, NPR, and The Nation, and now science teachers turned amateur panel moderators. Eowyn Savela is an organizer with the advocacy organization Planned Parenthood Advocates of Greater Washington and North Idaho, where she has managed their endorsements and campaigns since 2023. She's also the Director of Public Affairs and Strategic Initiatives for Planned Parenthood. She has a background in healthcare, training, and marketing, and co-founded a regional civic engagement nonprofit where she served as board president for 4 years. Greg Winter is the Executive Director of Opportunity Council, a nonprofit serving homeless and low-income families and individuals through education, support, and direct assistance, while advocating for just and equitable communities. He's also one of the co-founders of the Colshan Community Land Trust. Dr. Frank James is the public health officer for the Lummi Nation and the Nooksack Indian Nation. He was a public health officer for San Juan County for 30 years, and was a public health officer for Whatcom County for 10 years. In addition to working as a primary care physician, he has taught at the University of Washington, School of Medicine and Public Health, and done a lot of work internationally as well. With that, let me get right into it. Jeremy, I want to start with you. As Attorney General, Governor Ferguson earned a reputation for his shrewd legal opposition to federal actions during the first Trump administration. I'm curious how that experience is informing kind of planning and response now to how Washington's going to respond to the newest actions.
Great, thank you. Thanks for everybody for coming out tonight. It's great to see everybody so engaged and involved. Yeah, as we all know, we're in good hands in confronting the second Trump administration with Governor Ferguson, much of it because of his experience as Attorney General. So I can say that Governor Ferguson is in close contact with Nick Brown, our new Attorney General, on a number of the cases that we're bringing against the Trump administration. He understands his role as the governor, right? He's not Attorney General anymore, but because of his experience in the past, he's able to give what support he can to Nick Brown. And I think he's in a unique position to be supportive on these cases. Just to go through a couple of the cases that our state has brought against the Trump administration, these are all, with protecting Washingtonians' rights is the main goal here. And so with Attorney General Brown's office, we were able to get a temporary restraining order on the birthright citizenship executive order, obtained the preliminary injunction. And we were the lead state on that one, and also the gender affirming care for minors that we were able to get the temporary restraining order and preliminary injunction on. We were a party to the lawsuit of the freezing the federal funds, and also got a preliminary injunction on that. And we're also got the preliminary injunction on the federal firings of the probationary employees. There is some movement on that since the judge just recently ruled that the federal government needs to reinstate those employees. And so in this past week, 25,000 employees have been rehired. So that's, at least they're following that order. So that's a good sign. So at least for the time being, those important federal workers have their jobs back. We're also, our state is also part of the lawsuit that were efforts to terminate the NIH funding for medical and public health research, which we also got a preliminary injunction on, and then the federal efforts to dismantle the Department of Education. We have joined that multi-state lawsuit. And then just two more. The unconstitutional override by Doge, we've joined that lawsuit. We are seeking a preliminary injunction, and also our AG's office has sued Adams County in eastern Washington over violations of the Keep Washington Working Act.
Good for you.
Dr. Baker, I wanted to start, I know I'm a teacher. I used to work in education policy in Congress. I worked closely with a lot of people at the Department of Education. I understand 50% of the department's staff was targeted for layoffs. The president wants to eliminate the department to the maximum extent appropriate and permitted by law. Federal funding for education is only about 10% of your local budget, with the rest of the balance kind of covered by state and local property taxes. I think the conversation I've heard is that that funding would either look like that the Title I funding streams, the IDEA funding for students with disabilities, that either it's expected that would remain intact at the Department of Education or potentially be moved to another department. But I guess I'm wondering if you could talk a little bit about the budget impact of potentially losing any of those funds, or even the impact of a potential disruption if they shift to another agency. I guess the funding piece first.
Sure, and I don't get to list all the lawsuits that I've been involved in like you did, so not quite as exciting. And I would just say, as the superintendent, I'm not here in a political sense as much as I'm here focused on our kids of our community and how the impact on them and our educational system. At the federal level, as you mentioned, for us it's about $10 million a year, and the biggest three, you mentioned two of them, come in the form of title dollars. There's a variety of title dollars, the biggest one being Title I, that goes to support areas of low income, high poverty areas. The second is IDEA, or special education, and then the third is the food program, or meal program. So any one of those three would be devastating if we didn't have those resources that flowed through. And, whether it's students with disabilities, low income, or just our kids eating meals, are all pretty integral to our organization. So on the financial side, that's what would be at risk, is up to $10 million.
Are you getting any kind of guidance or preview from like the state or national superintendents groups that are kind of giving you any kind of preview of what kind of cuts they realistically are actually expecting?
Well, like right now, I'm out presenting to all of our 24 schools and programs at staff meetings about the state of the budget. And one of the slides I bring up is around the potential impact of what's going on at the federal level. And I put a quote that was just given a couple days ago by the new Secretary of Education that says, that it calls out in some ways, two parts to this whole thing, at least from my vantage point, that she also one is the bureaucracy of the department. And you can read different quotes that from get rid of, to diminish, to move over, but change the bureaucracy of it. That's one conversation. The other is, at the end of the day, what's the financial impact? And her quote was, the intent is not to diminish the actual dollars coming to districts. So to the degree that I want to be hopeful, I will listen to that quote and believe that at the end of the day, they may change what department at the federal level, what bureaucracy manages those different pots of money, and whether it's at the federal level or whether a block grant is created and dollars are sent down to the state level and our state government manages those. I can imagine a variety of different structural changes. And so I don't have any indication besides fear, which is a powerful thing. I live more in the hopefulness that the dollars that we just talked about that at least affect education will continue to flow. And so, and that comes all the way to the Secretary of Education. So,
Are you getting any direct guidance from the Federal Department of Education, or are you kind of reacting to what you're hearing in the news too?
Most of the conversation at this point is flowing through from whatever conversation at the federal level to our state superintendent and interpreting that, and then at his level with 49 other state superintendents are all trying to make sense, have much closer relationships with the federal partners, and is interpreting that, I'd say more so for the superintendent. So not a lot of direct contact from the feds to districts, more funneled through the state superintendents.
Eowyn, two of President Trump's earliest executive orders, his day one executive orders were targeting reproductive health and gender affirming care. There was one that undid a Biden executive order that established this interagency task force on reproductive health. And then another one that I think Jeremy made reference to. It removed coverage for gender affirming care from federal health insurance policies, modified requirements under the Affordable Care Act for covering that, prevented hospitals or other medical providers who accept Medicare or Medicaid or who receive federal funding for research or education from providing gender affirming care of any kind under age 19. I've been wondering when I'm hearing about some of these things, like how real or how consequential are these versus like how much is it optics for his base or laying the groundwork for future action?
Thank you. I want to say thanks for everyone for coming out. So good to see you, and that is very reassuring to see so many eager faces here in the crowd. This is a great question. To use your analogy earlier about which rooms in the house are on fire, certainly there have been more direct impacts on gender affirming care. However, if you want to look at the state of reproductive health in general as the room, there's a tiny fire in the corner and they're just filling the room with flammable material. So the hammer hasn't fully dropped yet. So the first executive order you mentioned has no impact on our delivery of care at this point. Certainly the second one you mentioned about trying to limit access to gender affirming care has very real impacts on patients here in Washington State. However, it's more a direct patient impact and we don't have any direct federal funding that would be affected. We are providing gender affirming care as normal. We provide gender affirming care to patients over 18 who already have existing care and want to transfer into our practice, and we are carrying on as normal. But we are watching them. Everything that's happened so far is more about prepping for the big the big hits that are coming. So that's where we are.
So you said your Planned Parenthood's own services are not affected yet. Are you seeing any effects of providers yet, or is everybody just kind of watching and waiting? And I guess I'm wondering if you could talk a little bit to how your understanding of how that order aligns with constitutional law or Washington state law. Although you're not the attorney, but yeah, whatever.
Actually, I've been wondering this myself today, especially in preparation for this panel, about the limits on, like, for example, federal insurance no longer covering gender affirming care. That is in direct conflict, in my understanding, given I'm certainly no lawyer, with Washington state law that requires, I believe, most private insurance to cover gender affirming care. So I haven't seen anything. If anyone knows anything, let us know. But I'm kind of curious to how that will play out.
Greg, I know, I'm wondering if services that Opportunity Council provides in our community, sort of very vital social services, the safety net that a lot of folks depend on. Could you talk about how much they either directly or indirectly rely on federal grants, or does money flow from the federal government through the state to Opportunity Council, or kind of where, how would the funding be spent?
I just want to thank everybody for showing up. What a great crowd this is. If I could just, the little commercial part of this is, for those of you that are not familiar with Opportunity Council, we were primarily focused on helping people with housing stability, financial stability, school and work readiness, and other health-related care. And so far, I can say, being very technical about it, for the programs that we operate directly at Opportunity Council, they largely have been unaffected by any of the changes that we've seen so far. However, there's a big but coming. There's certainly an effect on staff morale, because we expect there's going to be some other shoes falling at some point later this spring, summer, or fall. We don't know what that's going to look like, so it's very hard to prepare for that. And you asked specifically about, how much do we rely on federal resources? About 30% of our funding comes from federal programs, either directly to Opportunity Council or through state or local government, then to Opportunity Council, and then to the people that we serve. So that's about roughly $18 million a year. And most of that is, direct assistance that are paid either to help people pay their utility bills, their rent, a portion of their rent, or for other services for our clients. And I think what we're probably most concerned with right now are things that are happening outside of our own agency's direct control. I'll leave it to Silky to talk directly about immigration, but I'll just say that we're very concerned about this, immigration policies driving people further into the shadows and not being fearful of getting the services that would benefit their families. And we have seen that directly at Opportunity Council in our preschool programs, where we're under-enrolled because some of those families are afraid to enroll their children, which is terribly sad and tragic. I don't know how much you want me to go on, but concerned about whatever's coming with Medicaid. I'm very fearful for what might be coming down the road there. So many people in our community rely on Medicaid for so many different types of services. So that concerns us. What I've been reading about going on at the Social Security Administration and the bureaucracy there that might be disrupted. Imagine losing field offices and reducing access to those services for retirees and people with disability income. These are folks living on very restricted fixed incomes, and anything that could disrupt the flow of that income to them, especially as it relates to housing, could be devastating for people. We've seen an enormous rise in senior homelessness, and I just shudder to think what might happen if that takes place. One that I'm going back to Opportunity Council that I'm very concerned about is trade policy and what's happening with these tariffs, because it's undoubtedly going to affect the price of construction materials, which is going to really have an impact. Was that lightning? Did I wrong? Okay. I didn't know we had a time. No. So I'm very concerned about, all builders, especially the nonprofit developers, who are trying to put up as much affordable housing as we can with the dollars that are out there. And these tariffs, I'm afraid, are going to result in less housing production, less affordable housing production. So I better stop there and give you back the mic for now.
I brought my light up teacher timer. It's for me so that I have a sense of how much time has passed. Silky, I was struck, I'm sure as many of us were, by some of the news in the last week, particularly Mahmoud Khalil, who was arrested at Columbia University. He had led a protest over the war in Gaza. Do legal permanent residents have fewer legal protections than citizens? Like I wasn't aware a legal permanent resident could be deported.
Y'all can hear me? Okay. Hi. Yeah, I just want to echo Greg. It's incredible to see all of you here. All my work is focused on federal policy. Detention Watch Network's a national organization. I live here because I'm a +1 to a Western professor. But I've lived here for 10 years. I'm really inspired by the group of people who are here.
Turn up, speak up. The microphone is not the same.
Oh, fine. Is it working? Okay. Yeah, just really inspired. I feel like there's a lot of discourse. It's like, where's the resistance? And this is giving me inspiration. So,
There we go.
on what happened with Mahmoud Khalil, like the reality is that yes, if you're a legal permanent resident, you can be deported. That's been the case for a very long time, and laws passed in 1996 made it so like a lot of legal permanent residents could be put into that. A lot more people who had contact with the criminal legal system, for instance. Detention Watch Network, my organization, actually was founded in light of those passage of these laws in 1996. And so a lot of the people we work with are people who have been in community for a really long time, might have a past marijuana conviction, might have a past drug conviction, have been funneled into the system. The thing that is so different about what happened to Mr. Khalil in particular is the fact that he is being attacked for his speech because of thought crimes. And I think the thing to understand here is that so much about what we're seeing in this period of time, and I think what Jeremy was sharing earlier, is you have these really extreme things like, okay, we're gonna attack birthright citizenship. They knew they were gonna be sued around that. They knew that was gonna happen. The goal is to sort of shift the Overton window, to shift what they think is possible, and this is sort of what's happening with this case, where they're saying, okay, yes, a lot of undocumented people can be targeted for detention and deportation. People who have visas, who have legal permanent residency can be targeted for detention and deportation and have for years. That is the norm. That is what we know. But what they're doing now is doing what they've been doing with immigrants for some time, which is sort of pushing them out of the public sphere. And as Greg was saying, doing everything to say no, they can't be a part of public life, they can't be a part of the public sphere. And that is sort of what's happening with student activists, with people who are speaking up for unpopular ideas, for instance, for the liberation of Palestine. So I think that is what we're seeing now, is how much further can they push this, and why it's such an important case to say, no, free speech is so essential in this, and this shouldn't be, somebody shouldn't be subject to detention and deportation in this context.
How much of this is are there changes in federal law or policy guidance, and how much are we just seeing changes in enforcement, like choosing to enforce laws that were already on the books?
Yeah, I mean, I think the one thing to name, and I think what was so absolutely depressing about entering into 2025 was the passage of the Lake and Riley Act, which some people may have heard of, which is this absolute tragedy of this woman who was killed in Georgia by somebody who was an undocumented immigrant who was Venezuelan. And this is what we saw time and time again from the Trump administration and from the Trump campaign, was exploit these very specific tragedies that are just so really awful stories, but actually are just totally one-off things that don't really happen. This is not actually the norm in any way, and say this is who immigrants are, which is absolutely not true, and scapegoating a whole category of people and then subjecting them to these really, really horrible, inhumane policies. And so the Lake and Riley Act is actually the one piece of federal law that we've seen change. And actually even here, you're seeing people in Spokane Valley, for instance, be targeted because of this law that says an undocumented immigrant can be charged with a crime. They don't actually have to be convicted of a crime, and specifically theft crimes, because this person had a previous theft conviction or something. It's a totally absurd policy, and that changed. But otherwise, nothing's actually changed. And so people, everything that we're seeing here is more and more money and resources being funneled into the system to target more people for detention and deportation. All the laws on the books are exactly the same. So that, yeah.
And I guess this is a related question, but in your view, is the Trump administration exercising authority that the executive had, or are they exceeding their authority and breaking the law?
Well, I think the Khalil case is an example of breaking the law. I think even just this last week, this last week is like an absolute turning point where you saw that invoking of the Alien Enemies Act from 1798, which hasn't been invoked since, I think World War II, when people were incarcerated or Japanese American, really dark times in our country's history. And a judge said, no, actually, you can't send these Venezuelans to these prisons in El Salvador, Bukele, who's like a totally authoritarian leader, and sending them to a gulag in El Salvador. Over 230 Venezuelans who supposedly had some connection to a terrorist a gang organization in Venezuela, which is very, very much made up. But anyways, just to say, they're already doing these things with impunity in every way, and I think we have to be careful and see what's happening now. But at the same time, there are, we do have judges and laws in place, and we should fight, and we should make the case that actually a lot of the stuff that's happening is illegal, and not just accept that those things are okay.
Frank, in the healthcare space, I'm wondering if you could talk about some of the impacts you expect to see, or what you're worried about in terms of the resizing of the federal government. Like they laid off 1,300 employees at the Centers for Disease Control, including from the Epidemic Intelligence Service, 1,500 employees at NIH. Talk about the impact you think these will have, and I'm particularly wondering about our preparedness for our next pandemic.
I'll hold this here so I can speak better. First, just a brief contextual thing. When I came here tonight, my wife asked me a question. She says, will there be security? Have you ever thought what how different the world is today? That's just astounding. And the thing we kind of went by just now, that once a person can be arrested for speech, where does that stop? It doesn't stop anywhere. What's going on is unprecedented, and it's not okay. I'm a brave person. I stood up against a lot of stuff, but I'm afraid, and I'm fighting that fear. So just be with me.
Thank you.
About this specific question you asked. So, Medicaid is currently slated to go down by $880 billion. What that would do locally, as far as I can tell, there's a very large primary care network here called Family Care Network. And everybody's worried about the people that get those services. I'm worried about the systems that deliver their care too. They would probably survive with difficulty. Primary care is on the edge. I ran the clinic on Orcas Island for a couple of years, just recently. And what I learned was that it didn't make money. The only reason that clinic survived was because the hospital that was sponsoring the clinic made money on radiology referrals, lab referrals, and specialty procedural referrals. That's how the budget was balanced. Organizations like FCN do not have that, those income streams. Those all go to the hospital. So I think, I called friends at FCN and I talked with them, and they got about 15% Medicaid, 50% Medicare, half of the Medicare are actually pretty well reimbursed with supplemental plans. All those people would probably go away, but that means that 30% of their patients are going to go someplace else. Now, they're backed up. They've got a backlog of patients that want in primary care, so they're going to do okay. And I thought, that's great. And then I thought about where those patients are going to go. And I remembered the 10 years of my life when I tried to build a clinic here that was called Interfaith. Back then, it's called Unity Care now. And those were hard times. I made about, to start with, about a third of what other people made when I was doing that. It ended up being about 2/3 of what other people made. But it was a really hard thing to build. It sees 50,000 visits a year, Unity Care. Where all those patients are going to go are going to be to CMAR, to Interfaith, and to the tribal clinics, all of which will probably not survive what's coming at us. Which means that not only will the people not get care, but the systems that provide that care are probably not going to survive. I spent 10 years of my life building one of those things. And I'm working right now trying to make the lung clinic the best clinic it can be. And the clinic out there is as good as it gets. It's as good as any clinic there is. But those things are likely going to go away unless we do something differently. The finances, they can't survive those cuts. So, surprise, surprise, wealthy people are going to do well. And people that are brown, and people that are from somewhere else, and people that are poor are not. Now, we as a community are resource rich. We are in the one state I would want to live in. We have a great governor. We have great elected leadership throughout. So I think we're going to be probably okay, and we're going to piece together things so that it's going to work for everybody in our community, because that's the kind of people we are. But the rest of our nation is not. Trump has done so many things, I don't have time to talk about 10% of them. The biggest thing I care about, Jeff Duchin, the health officer in Seattle County, and I had a running joke. And our joke was that we're going to work 7 days a week, 14 hours a day for years, and we're going to save the people in our community from COVID, right? And we did that. Jeff did a great job. In San Juan, we had 2 deaths in the first 2 years, 4 deaths in the entire pandemic, because we did what it took. But our joke was this: we do that, and unless we win climate change, they're all going to die anyway. And that's not a joke. And the first thing he did a couple of things out of the chute that were really dramatic and highly impactful. First, he withdrew from the Paris Climate Accord. Well, we've already gone over 1.5. If we get 3 more degrees this century, it will cause a third of our GDP capacity to go away. If we just spent 2% of our GDP now, we could overcome that challenge, but we're not in a place to do that right now with this political leadership. We're going exactly the wrong direction. And honestly, all these things I care about in terms of healthcare, they're not going to matter unless we win these environmental issues. So what that tells me is all these things I really care about in healthcare, and all the things I can tell you about healthcare, are not going to matter unless we win on some core fundamental issues. Now, I'm really glad you all showed up here today. It gives me hope, just like it gives everybody up here hope. But we have to organize. And in the interest of time, I will cut to what I think you should do. I've got a really active Facebook page. I've got a few thousand people follow me, and I often tell them what to do, just like I send out an email to everybody, tell them who to vote for, all the judges and all the things. You can amplify things. So one of the things I said recently, send a postcard and tell the president he's fired. None of us do that. He'd pay attention. But seriously, when you leave here today, go home and get a dozen postcards and stamps and write them. Who do you write them to? I've got 2 sisters that are both Republicans. One's really poor and going to get kicked in the teeth with this, and one's really rich and she's going to do really well. Both of them have brains and hearts, and I'm going to write them postcards. Who else? We have 2 elected Republicans representing our state in Congress right now. Okay, they represent the middle third of the state and the eastern third of the state, the 4th and 5th congressional districts. They represent us. We need to be writing them postcards. We need to be writing our friends that live in their district postcards. We have to take those kinds of actions. It can't all be about postcards. And their names are Dan Newhouse and Michael Baumgartner. And they're good people, they're smart people, they're caring people. We've got to get to them. We have to get to them. Find your relatives, find your friends. And we've got to challenge them at every turn. And it doesn't have to stop there. We just got to go to Linden. There's plenty of people up there that actually don't agree with us about anything. But what they do agree, when I was running the health department, it used to be a health district. And I had to get all the small towns to donate money, to pay money to make the health department work. And you know what? I learned after 1 year, if I go to Linden and convince them this is in the community's best interest, not only would they pay the bill, but they get all the small cities to do it too. They are good people with good hearts, and we can't let these artificial barriers come between us. But we need to reach out to them. We need to reach out to them, and they need to feel what we feel in our hearts. This can't happen. This is something we cannot let happen. This is the biggest thing in my life, and I think probably the biggest thing in your life that's happened. And we need to organize now. Now, I've been on and off Democrat. But I think that party and their leadership is all that we have. Because it's got to be organized, it's got to be systematic, and we've got to quit disagreeing about things and come to some common understandings that we can take action on. I'm really glad you invited me this tonight, because I think we have to do this. And if we don't do it, there are huge consequences. I don't have time to tell you all the consequences, but everything that these people are doing is draconian. And it's all headed in one direction. That is a financial elite running everything. That's literally the game plan. And doing away with our government as we know it. That's real. It's not a joke. It's not an overstatement. So get organized. Come back. Be friends. Don't be strangers. And thanks for the organizing.
I'll come back to you again. Jeremy, how real does the governor think that the threats are of retaliation against blue states or sanctuary states? In what ways is Governor Ferguson thinking about how our state government can respond and protect us from retaliatory political actions or disruptions in key federal services?
Great. Thank you. Yeah, so Governor Ferguson obviously takes seriously protecting our rights as Washingtonians and the values that we hold dear. And so those threats against so-called sanctuary states, he takes seriously, and we haven't seen a lot directly aimed at us yet. But we are ready and are doing things to prepare for that. So there are limits that what we can do as a state in response. It just depends, depending on specific situations. But what the governor wants you to know is that he and his team, our team, is planning ahead. We're standing up for Washingtonian civil rights, and we are holding tight our values that make us Washingtonians. Here's a couple examples of what Governor Ferguson has done over his first couple months in office. So when he came into office, the DOH, Department of Health, had a backlog of 8 to 10 months for folks seeking an amended birth certificate to accurately reflect their gender identity. So in response to the federal administration's actions and the president's executive order, a team of about 20 employees of Department of Health went and worked through a weekend to clear the backlog entirely. This happened about a month or so ago. There's now no backlog. And going forward, DOH is processing requests for amended birth certificates within 5 business days. And provided the requester has supplied all the necessary information. So that's something that we did kind of proactively. On immigration, in response to the federal government's threats and things that topics that Silky was touching on. The governor signed Executive Order 2504, which established the Family Separation Rapid Response Team. And in collaboration with local and statewide experts on immigration and child welfare, the response team is focused on mitigating, to the extent possible, the harmful effects of family separation resulting from deportation or detention of parents and primary caregivers. So the team has already met twice, and the third meeting is scheduled for next week, and they're due to provide a status report to the governor before the end of April. On reproductive rights, one of Governor Ferguson's very first acts upon taking office was to sign Executive Order 2501. So 01, that's the first one. He established a strategic convening to explore policy proposals for protecting and facilitating access to reproductive rights, reproductive health care, and gender-affirming care. So the executive order that Governor Ferguson signed called for our Department of Health to gather medical providers, reproductive health experts, policymakers, stakeholders, and individuals with lived experience together for this strategic convening, in which they could discuss ideas and policy proposals for ensuring continued access to and availability of reproductive health in Washington. And the strategic convening took place this past weekend, and we look forward to DOH's efforts to consider and implement, where possible, this group's recommendations. On federal layoffs, which has of course been in the news a lot, Washington State is the proud home of about 76,000 federal employees, and our Employment Security Department has made resources available specifically for these folks who were recently fired from their federal employment as a result of the DOJ and OPM terminations. So ESD has made a special website available with instructions specifically for federal employees that has committed additional resources to processing their claims as promptly as possible. And ESC has seen a significant increase in claims for former federal employees as compared to this time last year as well. And the department's working hard to get them the benefits they deserve. So those are a couple things that we're kind of trying to be proactive on what we can.
Dr. James talked a lot about the potential impact of Medicaid cuts. And I guess I've been wondering, given Washington State's own difficult budget situation right now, are we at greater risk for negative impacts in the face of potential Medicaid cuts? Is that something that's, I don't know how much we can plan for?
Yeah, it's possible. It's definitely something that we're concerned about. As Frank said, that would be devastating if there's Medicaid cuts. Just some numbers here, so 1.9 million Washingtonians are on Medicaid. There's 57,000 of them are Whatcom County residents. And for Washington, the federal government pays about 70% of the Medicaid expenditures here. So if the federal government share of that funding decreases, we will have to backfill that amount with state funds. And of course, we're in a tough budget situation, as you said.
Tough is $15 billion in the hole, then made up about It's $15 billion in the hole because we're a trade-dependent state, so we're in a very difficult place, and they've made up about $7 billion with very substantial cuts to the budget. So we've got a difficult place.
That's true. Yeah, 15 billion is the estimate in the hole, and the governor's proposed some cuts there, and the legislature will be presenting their budgets next week, and the governor's going to take a good look at revenue opportunities as well. But yeah, this is definitely something we're.
Dr. Baker, some of the president's earliest executive orders and personnel changes have been focused on eliminating anything related to diversity, equity, and inclusion. And that kind of HR terminology actually has a lot of overlap with kind of a guiding value of special education in the United States. Like the idea of inclusion is the gold standard. Before the Department of Education, students with disabilities were excluded. And I think, while in as much as anybody thinks about the Department of Education, we probably know there's some funding stream, but one of the primary responsibilities of the department is around civil rights enforcement. Their Office of Civil Rights, they ensure that states and districts are complying with their obligations to students with disabilities. I'd love to hear what are you and the leadership team in Bellingham Public Schools doing to make sure that our schools maintain the same values and fulfill your obligations to students with disabilities?
Yeah. So part of what I do in my job is, like many folks, is take all this in. Lots of places you can choose to do, but part of it is like keep people focused for education on the work that we do. And the terms equity, diversity, inclusion, and I've written to our community on this. It's sad that it's been politicized, but it currently is not going to change the values that we put on that. We use those words proudly in our district. We believe strongly in equity. That's what we fight for every day. We believe that diversity enhances our community. That's a value in our Bellingham Promise that's bigger than, it's been in it was written by our community and has been in our community for over a decade. Inclusion is something we want all kids to feel included in our schools. So we continue to say those words. The term EDI, politicized, is there going to be some other way to say that at some point? Yeah, maybe. But right now we stay strong with our beliefs, the values that we have that are bigger than just me or our district. They came from our community. So part of what we do is with our kids is continue to lead with those values and not be deterred by whatever might be out there, trying to say you can't use those words. It's just not what will drive us. And so, we have pockets of our community, that have been acknowledged tonight, that have been harmed by this political discourse in deep ways, whether that's with immigration, whether that's students with disabilities, our LGBT community. So part of what we can do is one of the very first core value of the Bellingham Promise is all children will be loved. And so what we will continue to do is come every day in our staff and make sure that every student feels loved. We don't get to see the kids all day. Kids go home at night and deal with the bigger world, but at least for 6-7 hours a day, we have the ability to influence and support them. And however they come in, whatever they heard the night before, watching whatever, we will focus, and our staff does, on lifting them up and embracing them. So that's, I'm proud of using words like equity, diversity, and inclusion, and I will remain that way. And this is a community that has lifted those words up. And so again, as much as there's going to be advocacy here to do things, which is great, part of what I do during the day is focus in on the children that we receive and doing the great work there, regardless of what happens outside.
Do you have any concerns about future guidance? The Department of Education kind of sends out like, hey, the schools, districts, states, this is what we expect you to be doing. This is how we want you following particular policies. I've been wondering if local education agencies could actually be prohibited from collecting data on race, which is used to ensure that all learners are succeeding. It's these kind of federal guardrails, and I'm wondering what you think about that, but also just guidance in general that you think might be coming.
Yeah, this is, I got to walk a fine line. I'm not the politician, and I'm not a lawyer. I'm an educator. To try to answer your question, this last month or so, I've had to get very much more attuned to what is it someone's telling me, and how legal is it or not. And I've learned way more than I did of what exactly can an executive order, what's behind that legally, and why is a federal executive order different than a governor executive order during a time of crisis. And there's differences. What's a letter that gets sent out? So I've been, over the past month or so weeks, been told a lot of things in letters and communication, and I have to parse out what is someone trying to influence and use big words to tell me to do something and what is legal. Now, we're gonna follow the law, and the last time I took civics, it's the legislature that passes laws. And so that's where I'll look for direction for new laws, is from the legislature.
Eowyn, I'm wondering if you could talk a little bit about what additional executive orders or tactics you're expecting to see from the Trump administration to leverage funding to target gender affirming and reproductive health care.
I certainly can, but I want to take a minute too to just make some observations. Just it's been great to hear the thoughts of the other panelists, and I just want to note, and I hope you're noting too, that all of the challenges we're talking about, we're all connected, they all intersect. So Dr. James talking about Medicaid funding, 30% of our patients are Medicaid patients. The governor's first executive order convening that body to examine support for reproductive health care. Of course, I don't know if you know this, Planned Parenthood educators provide peer sex ed education in the Bellingham schools. And of course, that's the foundation for making the choices you want to make about your bodily autonomy and how you choose to move ahead in the world. So what I hope you're taking is, in seeing all these connected points, and maybe you're feeling the overwhelm of like, oh, all these terrible things, and I'm about to tell you a bunch more terrible things. Pick one thing to work on and you will affect all of it, okay? So you don't have to do it all. Pick one thing and do that, and that will help all of us. That will help the whole community. Okay, brace yourself. Here's a bunch of horrible things. In our internal meeting, we call these the parade of horribles. This is what we're waiting for. This is the fuel that they're filling the room with. So these are things that could happen. I want to reinforce these haven't happened. There's been no effect to our services. Please come get the services you need. Here we go. The first time round, first Trump administration, they kicked abortion providers like Planned Parenthood out of receiving federal Title X family planning funding. No federal dollars are spent on abortion. However, what they said was, no abortion providers can get this family planning funding. We were fortunate in that case. Washington State stepped in to backfill those dollars, so no services were affected. We'd be hopeful if that were to happen, the same thing would happen. However, as Jeremy and others have pointed out, the budget is grim. More on that later. Another thing that could happen, we were expecting to get just Planned Parenthood kicked out of Medicaid funds. For better or worse, it looks like they're gonna try to do the whole thing, which is not good, but it helps us have a stronger fight against that. There is another federal program called the 340B program that allows us to get discounted medications. They might try to kick us out of that. Banning federal Medicaid coverage for gender-affirming care, which has not happened yet, but I think you could imagine that happening. A medication abortion. So certainly there was a Supreme Court decision last summer that allowed the primary medication drug mifepristone to remain on the market. There's two drugs used in medication abortion, mifepristone and misoprostol. They're going to do everything they can to try to continue to make mifepristone unavailable, including, and if they need to, reinstating this ancient law called Comstock. Have you heard of that? Okay, this one is kind of scary because it would prevent supplies used in medication to be sent through the mail, which is nice and vague. We're not sure exactly what that would mean. That would be a real tough one to figure out, although you can rest assured that folks within Planned Parenthood, the Federation, and all of the state affiliates are brainstorming ways to deal with that if that were to happen. And then, you know, abortion is very popular. However, everything that they're planning and that you've kind of seen them poke at is backdoor into a national abortion ban. They won't probably go for that outright because it would be very unpopular, but all these things are ways to have the same effect. But that would allow them to say, oh no, well, we wouldn't do that, but they would make it very difficult to obtain one. So I think that's fairly unlikely, but who knows? You know, they may try.
I want to, real quick, I'm curious what you're hearing from Planned Parenthood National or in your circles. Is there any expectation that there will actually be like legal prosecution of providers, even in states where there are protections?
They'll try, but we live in Washington and providers are protected here. There is a SHIELD law that went into effect a couple years ago in Washington state that protects providers and people seeking care. In Washington, there's a bill that's moving its way through the legislature right now that would strengthen that SHIELD law and further clarify that more people are protected. So if you donate to an abortion fund, you'd be protected. If you let someone stay at your home who's seeking care, you'd be protected. Just further clarifying that language. I don't know, Jeremy, did you want to add anything? Okay, great. So I don't know if you saw, there's a lawsuit right now. I think someone from someone from Florida got abortion care in New York, and now Florida's trying to prosecute the New York providers. It's legal in New York. It's not going to happen. So we're in a good spot that way.
Greg, I'm curious about, I want to know kind of what folks in your organization are thinking about or preparing for just in general. But I similarly to what I asked Dr. Baker, given the intense focus we've seen so far in this administration on targeting anything that looks like DEI, I've been wondering if you provide any services through Opportunity Council that are specifically targeted at historically marginalized groups like LGBTQ folks or people of color, where a funding stream could be targeted and eliminated for that, or is that particularly anything you've been wondering about?
Yeah, it's horrible that it feels scary to talk about these things because you don't want to stick your neck out. But I'm proud to say and very pleased with our board of directors that at the last month's board meeting, they affirmed Opportunity Council's commitment to diversity, equity, and inclusion. Just as Greg was saying earlier, these are just core values of our organization. They're not things that we're willing to compromise on. We can't. We wouldn't be who we are as a community service organization if we did. So, we'll continue to want to work with and have formal and informal relationships with other organizations that are led by and organized for people of color, people with disabilities, to help us extend our outreach to get our services out into the community as widely as we can, and we'll continue to do that. I can maybe imagine in the worst imaginings where somebody's going to try to stop us from doing that, but that's not where we're headed. Was the other part of your question to what keeps you up at night? Well, with the advice given earlier about maybe pick one thing, because as you saw earlier when I was speaking, I couldn't pick one thing, but housing assistance and what might be happening at HUD is something that concerns me greatly. We're already horribly underfunded with things like, the Section 8 program and housing vouchers to help people afford housing. And the office in HUD, Community Development and Planning, that we have the biggest relationship with, is slated for an 84% cut in staff. And you can imagine, as Dr. Baker was saying earlier, that maybe even if the funding might stay, but that level of staff cut is bound to have terrible consequences, even if it's only being delayed, getting paid, getting reimbursements for the services we're providing. That has real cost. The cost of floating those costs over time really eats into a nonprofit's bottom line and affects how they can serve the community. But the scariest part about this might be if there's further erosion in the amount of rent assistance that's available to communities across the country and to our community, and what that will mean when other parts of the safety net might be shredded at the same time. I just shudder to think what's going to happen. We're already in a situation where if you talk to the housing authority, they're not able to fund all the vouchers that they have the legal authority to issue because of rapidly rising rents. And as that trend continues, it just further and further erodes our ability to deal with homelessness and just generally people's security at home. So those are the things that we're going to be watching really closely.
Silky, another one of the kind of day one executive orders that the president signed authorized state and local law enforcement to perform the functions of immigration officers. Jeremy, I think, mentioned that our Attorney General in Washington, Nick Brown, is suing Adams County for helping ICE to detain immigrants in violation of the Keep Washington Working Act. If you could explain a little bit what that legislation is, or what Washington's approach is on this. But then, I'm curious how you think that's going to play out, like the tension between the federal government and our state laws here.
That's a great question. I mean, Keep Washington Working is an incredible piece of legislation. I think, the only state that has better legislation is Oregon, really has the best sanctuary legislation in the whole country. But Keep Washington Working means that local and state law enforcement can't collaborate with ICE to detain immigrants, and also counties, for instance, can't go into contracts with ICE to detain immigrants and make money off of those contracts. And it's been a remarkable way to make sure that Washington residents aren't targeted, and it's been quite successful. So many more people are protected. This is what we saw from many years, and I've been doing this work for 20 years. How people were funneled into the immigration proceedings was often because local law enforcement, through stopping somebody for a taillight, or if somebody was in booking out of jail, would then put them into immigration proceedings. And that can't really happen in Washington now, which is great. And that's how we saw, from years of having really high levels of deportations under the Obama administration, early Trump administration, they started to go down because of sanctuary policy. So we really want to protect this. And we're starting to see these things go up, but we can talk about that. But the thing I'll say is Keep Washington Working is protected under the 10th Amendment. I think, as far as we know, as this legislation it's not threatened under because it's protected by the 10th Amendment, so I'm not too worried about it being challenged. I think one of the challenges is that in Congress there's been efforts for this no bailout for blue states or no bailout for sanctuary states law, and that could be questions for Governor Ferguson, like what is that going to mean in terms of how the state is responding. But ultimately, I think, as this law stands, I think we're in a good place on this litigation, as I've asked some of my colleagues who do this litigation. So yeah, I'll say that.
So even if our local law enforcement officers face state level of prohibitions on cooperation, can you educate us a little bit? Like what power do federal immigration officers have locally?
I mean, I think the hard part is that DHS officers, ICE agents often arrest people regularly, like the story I was telling you about that happened in Spokane Valley. Like, they will say they have a warrant when they don't have a warrant and just target people and just say, no, I'm going to take you in and lie. That's what happened with Mr. Khalil at Columbia, and that happens all the time. But the reality is that in order to actually be detained, you need to have a judicial warrant. People should ask for that. There's a lot of resources on Know Your Rights. I know the Washington Immigrant Solidarity Network, One America, other groups here in Washington, Northwest Immigrant Rights Project have all those resources. And so much about this, and I think Dr. James was talking about this, this is about organizing. This is about not just, we can't just outsource the resistance to lawyers. It's wonderful that Washington State is fighting this, that you know, the AG is fighting this, that's great. It's great that we have organizations like Northwest Immigrant Rights Project, but we need to do the work to protect our communities and make sure that our community members, our loved ones, our neighbors are being protected. And I think one of the biggest challenges, I'll just say, is that what we saw with the shifts in the Democratic Party over this last 4 years, where it moved to the right on the issue of immigration, is really, really hurting us now. We had Democrats vote in favor of the Laken Riley Act. We had Chuck Schumer just be complicit in accepting this budget that has $500 million additional dollars to ICE, and also allows them to not have any transparency requirements, so they can have essentially a slush fund to target more people and take money away from Medicaid and the things that we really desperately need. And so much about this is moving the Democratic Party and saying, no, you have to stand up for our rights and stand up for immigrants, and have a doggedly pro-immigrant agenda, which they've essentially abandoned at the federal level, and that is going to be such a big part of the work that we do.
Is there anything you haven't talked about yet that you're most anxiously watching for? Like, oh boy, I wonder when they're going to do X.
Well, I think the Muslim ban 4.0 is coming, which means that people who are from those potentially 43 countries, which I'm sure is going to be, again, attacked in the courts, but they could be then targeted at ports of entry. If you go travel anywhere, if you're going to Canada and you're from essentially any of these countries and don't have citizenship, then you could be targeted for detention, you could be put into proceedings. We're seeing more and more people being targeted at ports of entry because sanctuary law has been so effective. Actually, there's so many more people who now, you know, they're at the Logan Airport and they're being put into proceedings just because that's the way to kind of bring people into the system. So that's something to be careful about. I'm really worried about the registration requirement. They're gonna, I usually am with a lot of young people who don't remember this, but after 9/11, there was this thing called special registration that forced a lot of Muslim and Arab men to register with the federal government and put 13,000 people into deportation proceedings. I mean, the numbers are going to be so much higher for what they're talking about. It's going to cause a lot of confusion in immigrant communities, and so I think that is something I'm really worried about. Yeah, I'll leave it there. There's a lot that's already happened in just the last week. They brought back family detention. They've done so much, and so I think the point that's been made is like focus on your thing, and I think in the immigration context, this touches every single issue. I mean, part of the reason we're in this place is because Governor Greg Abbott of my home state of Texas, I was born and raised in Texas, had this busing scheme, and it exacerbating the housing crisis in New York City and Chicago, and a lot of the Dems moved to the right because of this. And so I think we have to have a bigger conversation about our social safety nets and protecting everyone's rights, and also not throwing immigrants under the bus as a problem when actually it's a lot of other people and billionaires and other folks who are the problem.
Frank, you spoke about the awful impacts we could see from Medicaid cuts, not just for patients, but for clinics and our fragile healthcare system overall. I'd love to hear your thoughts about the kind of non-funding aspects of what we've been seeing. Like, what are you watching for, worried about in terms of guidance here, like around vaccines? I have a 4-year-old and a 2-year-old, and I definitely asked my pediatrician wife, what's next on the vaccine schedule, and can we do that now? She said no. But yeah, you know, the president just appointed a well-known vaccine skeptic, the head of HHS, and yeah, I wonder if you could speak a little bit to what you're watching other than draconian funding cuts.
Well, RFK speaks for himself. He's an idiot. I mean, he really is. I mean, it's just astounding. I mean, he's a charlatan. He's a guy who's made a living telling lies. And he's in charge. Think of that. I think the thing that really bothers me, to answer your question really, is the research funding that's being cut. We are the flagship of the world at NIH and in the research efforts throughout this country of universities. They're taking it down. I mean, that's going away. the steady progress we've made. Life expectancy gets longer every year, and it's because science works. Shocking. But that's being taken down. But I gotta say another thing, and that is that, I also work internationally. And what happened to USAID should not be unappreciated. USAID saved millions of children's lives, at least 3 million kids, millions of women's lives. So why did they take it down? What? They're not Americans, right? And there's people in our country that actually don't care about everybody. All of you care about everybody, you wouldn't be here. But there are people that don't. I was disappointed in Donald Trump being elected, but I was even more disappointed that about 40% of our population voted for him. And it took a long time for it to sink in that he is a flippant racist, maybe, but really he's using the racism in our population to his personal benefit. Who knows what he believes? He's an opportunist to do anything to get power. But definitely, we got problems there. We need to work on it. Myself and my family, my daughter's over there, and she worked in East Timor for 15 years. And for those of you that know about East Timor, it's the largest genocide in the past 100 years or so. We don't know about it here because we were on the side of Indonesia, which committed the genocide. But those are dangerous places to be. Me and my daughter, for God's sakes, have worked abroad in places where you can get killed. But what happened with dismantling USAID is just a crime against humanity. I mean, it's horrible. People, children, women, poor people are going to die in large measure because of what they've done. And make no mistake, they don't care what's legal. Trump just said, if I understood him correctly, that it constitutes a high crime and misdemeanor worthy of impeachment for a federal judge if they disagree with him. Yeah. Honest to God. I mean, legal? I mean, the lawyers are not going to save us. Maybe in the long run they will, but we got to get to the long run first. Secondly, popular. Medicaid is incredibly popular. It's one of the most popular programs in this country. It serves huge numbers of people. They don't care if it's popular. These people are hell-bent on power and control, and they do whatever it takes to get it. Kill children? No problem. Kill young women? No problem. These people are ruthless in a way I have never seen in my life. And they're effective in a way that I have never seen in my life. So I guess the punchline for me is we need to work together. The people in this room have to talk to each other. We have to keep in touch with each other. This is not the end. This is the beginning of a process. When I talked about this on my own Facebook page, I said, show up, because this is the beginning of what we can do to stop and change our course. This is it. It's in rooms like this all across the country that we're going to win this. We're going to win it by working together. We're going to win it by sharing our human values. You know, it's like what our superintendent said, you know. It's a core value, not just in the school district. It's a core value of all of us in this room and all of us in this country. We fought wars and died for those values. And we can't let them be taken away from us.
I want us to leave this room tonight feeling like we have just an inkling of some action we could take, or a little bit of direction. So I want to kind of move to that now. Jeremy, as a representative of our governor, this question is a little bit different for you. I don't know if it applies as much, but is there any legislation that the governor is working on that it would be good for our members to support, to signal to our our elected representatives? Or, yeah, where do you need the people in this room?
Yeah, no, in general, thank you. In general, just stay engaged. Like Dr. James saying, we have the power in numbers. And so beyond kind of what's in our legislature now and what the governor's going to sign, I can't say much, about specific legislation but as it comes through, just that related to the topic tonight of federal actions, influence coming onto our state, know that Governor Ferguson will be standing up for our rights every step of the way, and he will not, give up our values for no matter how big how big things are coming down from the federal side. So I don't have a lot more specifics to share.
That's fine.
But yeah.
No, I've got one more thing to share. There's been a phenomenon that's really unusual, and that is self-silencing. Obama's, the Kennedy family, the Bush family, who parenthetically hate Trump, all these people are silent. They're silencing themselves. That's another thing we, the people in this room, can do with those postcards or with those telephone calls. Call on the leadership. It's tried and true leadership. It's eloquent. Who's a more eloquent speaker than Barack Obama? Who has a deeper understanding of democracy than all those families? The Bushes are incredibly proud. They're incredibly proud of fighting AIDS, for example. They did a great job of that. They provide a global leadership. We need to stop the self-silencing. We need to call those people out into leadership. And that includes our own local folks. We can't be silent about this. It's risky and it feels dangerous to do. We have to do it ourselves, and we have to call out those leaders in our community to do it, and we have to call the Democratic Party to do it. Yes. And I'm glad you called me instead of me calling you. Thank you. But we need to do that. If we don't do it, nobody's going to do it. I assure you, if it's not the people in this room, it ain't going to happen.
Yes.
So we got to do it, and we got to do it now.
Dr. Baker, similar question. Are there, as you're thinking about what you need to make sure that Bellingham Public Schools keep performing and serving the needs of all of our students, are there specific policies or funding streams that we should be asking our state legislators to pursue to protect public education?
Sorry, I'm going to jump in. I do have to leave in a couple minutes to pick up my parents from the airport, but thank you. Sorry,
it's a good reason.
Okay, but thank you, everybody, for coming out.
Don't leave yet, because my message is right to the governor. Yeah, the biggest thing from my perspective as the school district is, with regards to funding, is, one thing to remember is our state constitution. It says the paramount duty of the state of Washington is to amply fund public education. It's the number one thing. It's not number two, it's not number 10, it's the paramount duty of the state. So we're in a challenge right now that, and I have full respect for our legislators and governors that have so many things coming at them and priorities, but we as school districts are waiting to hear what our budget will be for next year. And with the challenges that you all know from inflation and higher costs, a hold steady budget for education is really a cut in education, because just to maintain what we do requires more resources. So for us, having those that are legislators and make laws and such, to remember what the paramount duty of the state is our kids. And it's the best investment we can make in our community, and that's what we need people to support. And with all this crazy stuff happening that we've talked about tonight, my view is how do we take care of our kids? And we're in a point right here where we're going to know in the next month how hard that could be, or how well we can do that moving forward. So I think that's what's on my mind.
I think there's There's a lot of folks in this room who care a lot about our local public schools. I don't know if this is too granular, or if you can predict anything like this at this point, but do you anticipate needing volunteers in classrooms potentially? Do you anticipate needing donations to fill gaps?
We always, yeah, I mean, volunteers and donations are certainly part of what we always can use help with. Those alone will not make the impact. I mean, what we need is our legislature, in my opinion, to do what the Constitution says and amply fund public education. That's one. Two, continue to have a community that supports education, because what has happened, and we'll see if it continues, is that the legislature, I'm trying to say it's very politically nice, if they don't do that, they will continue to say local communities, use your local levies not for what it's supposed to be, which is enhancements, but for basic education. And that's what has happened. That's what I'm afraid is going to continue to happen, is that they won't be able to fully fund education, and it will come back to communities. And some communities can't do that, and kids will be harmed. In our community, we have part of the reason I've been here as long as I have is it's one of the most amazing communities to live in if you're an educator, because the support here is incredible. But it shouldn't be taken advantage of by, and again, this is with all due respect, by the legislature not fulfilling their constitutional duty to amply fund K-12 education. So yes, volunteers, yes, philanthropy, yes, PTA, parents, like, we need all that, but I need some bigger things, which comes from Olympia. Thank you.
Eowyn, what else should our state leaders be doing, or what are they already doing, maybe, or working on that you know about to protect the reproductive health care safety net and ensure the financial stability of clinics?
Yeah, I have a very specific ask for you, and unlike Dr. Baker, I have a little more leeway. And it's too bad Jeremy had to leave, because I would have liked to. But you'll make the message clear for me. That'll be my ask in a moment. But I just wanted to say, I'm a product of Bellingham Public Schools. I have 2 kids in Bellingham Public Schools right now, and I don't take that for granted at all, and I think that I fully support our continuing support, and we shouldn't have to take our excellent schools for granted, and they shouldn't be taken advantage of either. I also wanted to, every time that Silky spoke, I wanted to remember to make the point of while there wasn't a legal change to immigration enforcement, there was a guidance change, maybe you saw, that made it much easier for agents to enter protected places like churches, schools, and healthcare facilities. This has a horrible impact on people's ability to seek the care that they need. But I want you to know, and please spread the news in the community, that Mount Baker Planned Parenthood does not collect anyone's immigration status. We never will. And we will not let immigration agents enter our facilities unless they have that correct signed judicial warrant. So okay, here's the ask. Here's what I'd like you to do. This is all about funding. Okay, the budget is really tough in Washington. There's no way we can cut our way down to a balanced budget. We need progressive revenue. Does everyone know what progressive revenue is? Okay, so to put it in reproductive health terms, for every dollar spent on family planning, the state saves $7 in the long term. Progressive revenue is popular. We just voted on this last year to continue our capital gains tax. I was really pleased to hear Jeremy say, wrote it down, that the governor will look at revenue opportunities. It's the first I've heard that he would be interested in doing this. So your job is to tell the legislature and the governor that you want new taxes on the rich. That's what it is. help all of us. I firmly believe the money is here. The money is in this town, the money is in this state. It's definitely in Seattle. Let's put it to use. Now's the time.
Greg, do you have any asks of us? Are there policies or funding streams that would protect Opportunity Council and ensure a continuation of your services? Are there needs for volunteers, donations? Please make these people do something to help Opportunity Council.
Well, I'm not going to pass up the opportunity to ask for donations. So sure, yeah, to answer your question. But seriously, you know, pick your favorite human service organization locally who gets federal funding that we fear may be going away, and think about making an unrestricted donation to that organization so that they're better prepared for a transition to services that may look a little bit different in the future, but are still out there serving the community, and allow that organization to sustain itself. As far as you know, what's going on in Olympia, again, housing, 2 focus areas for us and our advocacy network statewide are around housing and child care and early learning. Those are the areas that every 3 years when we do our community needs assessment, those are the things that people want help with the most. And we finally need to have rent stabilization. We've got to do something about this crazy runaway rent inflation. It's just, we've got to try this, and I think this is the year that it may happen, I hope. So I'll leave it at that.
The hearing is tomorrow?
Hearing's tomorrow. Sign in pro by 10:30 tomorrow.
All right, sign in for rent stabilization by 10 a.m. tomorrow?
Yes.
A.m. or p.m., Carrie?
10:30 a.m. tomorrow. Written testimony 24 hours after that is allowed. But see me afterwards if you want the link. We're trying to get as many people signed in pro as possible.
What's the bill number?
HB 1217.
Thank you, Bellingham Tenants Union. Sure, yeah. Silky, are there? I mean, you talked about the Keep Washington Working Active. You said Washington has one of the strongest kind of legal frameworks to protect us against some of the awful immigration policies we're seeing nationally. But are there other specific policy protections you think we should be advocating for, or do you want to point us at any state or local organizations where folks could get more involved?
Yeah, absolutely. I mean, I think, you know, like I said, Oregon actually has a stronger sanctuary law. One of the things that folks in Washington have been trying to do is to strengthen what is in Keep Washington Working, to make it so there's even an extension of the sort of separation between ICE and local law enforcement and Department of Corrections. And so that's some stuff that folks are trying to move at the state level, and we'll see. I don't think it's moving now, but I do think in the next couple years we could build some of that up. You know, when the first Trump administration happened, Detention Watch Network, the organization I work at, started a campaign called Defund Hate, and one of the things at the time is that the Democrats kind of believed if they gave more money to ICE, that ICE would just treat people better, which is just not the case at all. And so a lot of our work was to try to get them to see this differently, and over time we were able, and they didn't really get it then, but over time they were able to sort of understand, as there was, you know, the family separation moment, the Muslim ban, and other things that catalyzed people. And we got, I think, over 100 members of Congress calling on cuts in funding to ICE and Customs and Border Protection, and also stopped some $15 billion additional dollars that Trump was trying to get for ICE and CBP at the time. And I think we're in a really tough spot right now, and so a lot of our work is kind of going back to the basics of like, hey, this is what these systems do. And I think we have to be really careful because, you know, just 4 or 5 years ago, we were actually starting to really question, we have a system of very racist policing in this country. We have a really large system of mass incarceration. Those things are the reason why immigrants are more and more funneled into these systems. And if we keep sort of going down this path of thinking of immigrants as criminals or framing things in that way, we're gonna hurt our ability to fight for everyone. That's what we're starting to see, this push to denaturalize people, this push to target more legal permanent residents. How far will they go? And so I think some of this is narrative work, and also, you know, yes, this budget just passed, but they're already working on a fiscal year 26 budget, and I think all of us on this panel have talked about the impacts that that's gonna have, and so really talking to your members of Congress here and, you know, Cantwell and Murray, and doing everything we can to educate them and say, no, this is not okay, we don't accept this. And the Democrats have a lot of power when it comes to the budget. This is why last week was so hard. And so I just want to encourage us to do the work to educate ourselves. In terms of Washington State, groups like the Washington Immigrant Solidarity Network here, Community to Community, obviously, also One America and the Northwest Immigrant Rights Project, I think are all doing a ton of work at the local and state level to kind of strengthen protection. So encourage folks to check them out.
Thank you. Frank, you asked us all to work together. Is there anything else that the people in this room should be advocating for at the state level?
Yes, yes, there is. So, I like to study history. And one of the things that you notice really clearly if you look back over time is we are the wealthiest people to ever walk the face of the earth. We have more material well-being, we've got more knowledge. What we seem to lack is wisdom, but resources we have, and we have more than we've ever had in history. Resources are not the stinking problem. It's our consumptive lifestyles personally. One of the reasons I married my wife is she had a belief, and she said that it's not how much money you make, it's how much money you spend. And as long as you do that well, you can do pretty good. But I think we need to work both ends of this. I think all of us can become very selfless and very generous, and that's always a good thing. The more generous I've been, the happier I've been. And I think we all feel that way, because you really engage the community. The other way to engage the community is to get the absurd accumulation of capital that's occurred in the hands of just a few, so that it's not circulating amongst the rest of us. I mean, rich people have gotten so rich that poor people don't have enough money to buy stuff. I mean, that destroys the economy. That's a different way to destroy the economy, isn't it? But literally, we need to both be generous ourselves with what we have. Even more important, we need to do that more difficult thing, which is to get redistribution of wealth in a way that's more equitable. Again, we have nation states, but nation states honestly barely exist. You know, what they are is there are ways to have wars. But international corporations have, since 1970, been making profits where they're the highest, deferring production where production costs are the lowest, and then sending all their money to where taxes are the least. I mean, that's what multinational corporations do. And those things have allowed capital to accumulate in a way that it just makes everybody poor. So I think we need to both get equitable taxes and do exactly what our superintendent was saying down there. You know, he can't do it on bake sales. He actually needs an equitable distribution of resources from the top. And we need to stand strong on that. It's exactly the opposite of what's being done right now.
Yep.
There is a fast train going in another direction that's going to make us all into serfs. And we need to stand up to that. At the same time, in a relative sense, having worked abroad, we're rich beyond our own. We're so rich we harm ourselves with our wealth. We do. We get fat, we get, all that stuff. It's like, we don't exercise, all the things. We need to own that. We need to take that back. We need to be thin and fit and work hard, and to redistribute some of that wealth that we're spending on things that maybe aren't as important to us. I teach, and every student I have, I give the same task. I say, take a sheet of paper, draw a line down the middle. On the left side, write down how you spend all your time. And on the right side, write down what you intrinsically value. Now, what's interesting is the intrinsic value side always is the same. It's cooking, singing music, being in nature, being close with a friend. All those things, we're all the same. What's different is that other side of the equation, and the fact that we often don't, all the working we do and all the labor we do and all the long hours at night we do, they take us away from those things we intrinsically value. If we stick with the things we intrinsically value, we can get where we need to go personally, and if we hold our community accountable for the things we intrinsically value. We value young children. We value young mothers. We value everybody having an opportunity, don't we? There's like no question about that. But we've got to hold these larger systems accountable to those core values that we all have. It's not, Donald Trump didn't even get 50% of the votes. He says he has a mandate. I think we have a mandate to our core values, and we need to act on those values.
That's right.
I want to get folks out of here on time. I want to say, first of all, thank you to for all of you for coming out. Thank you for most of those questions were submitted, or versions of them when folks RSVP'd. Thank you for being so engaged and so thoughtful. Thank you to our panelists. I really appreciate you sharing your time with us this evening. I know I feel a little more informed, like I have a little more direction. I hope our audience does too. One more ask of you. We, as Whatcom Democrats, we want to know how we can be most helpful in coordinating responsive actions based on what we heard this evening, and whether there's anything we should do differently at future events. If you RSVP'd online, you already have something in your email. You've got a link to this survey. I would love to, I'll read them all. I'd love to see what you think. If not, if you just showed up, there is a sign with a QR code on it that you can take that same survey. Thank you so much.